Hello, my name is Abby Hankins, and this is Bariatric Surgery Red Flag Patients. Can we predict poor postoperative outcomes? Bariatric surgery patients undergo rigorous evaluation and workup prior to surgery. Patients may be red flagged due to psychological or behavioral concerns by any staff member. Psychological concerns include untreated psychiatric disorders, recent suicide attempts, intellectual disability, unrealistic expectations, and substance abuse, while behavioral concerns include noncompliance with dietary requirements, previously dropped out of the program, and no-shows to preoperative appointments. Red flag patients were followed during their bariatric evaluation, and we followed their progression to surgery, their postoperative weight loss, and postoperative follow-up compliance. The study was done to help determine early in the bariatric workup if surgery is the most appropriate weight loss tool for patients with certain psychiatric and behavioral concerns. Retrospective Epic chart review on a master list of patients in the bariatric practice was used. This included a randomized arm of red flagged and control patients. Overall, this included 185 control patients and 213 red flag patients. Patients between the ages of 18 to 89 on the initial consult were used. Patients presenting for revisional surgery of Roux-en-Y bypass, lap band procedure, and gastric sleeve were excluded. We collected variables on age, gender, preoperative weight and BMI, psychiatric history, diet visits attended, reason for red flag, time from initial consult to surgery, and weight loss up to 3 years post-surgery. In terms of progression to surgery, we found that red flag patients were approximately 22% less likely to undergo surgery. Patients flagged due to psychiatric concerns, no-shows, and substance abuse were least likely to progress. Prior dropouts did not significantly impact patient progression to surgery. Preoperatively, we found that it took red flag patients longer to progress to surgery than it did control patients, approximately 85 days. There was no significant difference in preoperative weight loss between the groups. In terms of percent excess body weight loss, this was similar among both groups. Control patients lost significantly greater weight at 1, 3, and 9 months, but weight losses at 12, 18, 24, and 36 months was not found to be significant. In terms of percent of patients who followed up postoperatively, this was similar and non-significant among groups. In conclusion, red flag patients were less likely to progress to surgery. Patients with untreated psychiatric conditions, multiple no-shows, and history of substance abuse were least likely to progress. Noncompliance with dietary guidelines was significant, but less likely to impact patients proceeding to surgery. Prior dropout was not significant in determining progression to surgery. Red flag patients take on average longer to get to surgery. These patients must demonstrate ability and changes necessary to qualify. This included more diet visits, psychiatric evaluations, or medical weight loss options prior to. Percent excess body weight loss postoperatively was similar among both groups. Postoperative follow-up was similar among groups. Poor follow-up noted among these groups. Few patients, including 4 control and 2 red flag patients, followed up at every expected appointment. Similar post-operative results were among groups, but greater resources were needed to progress red flag patients to surgery. This shows the potential role for medical weight loss therapy versus surgery, especially in patients with extensive psychiatric history. Further research is needed to evaluate which psychiatric conditions most greatly related to adverse outcomes. We are unsure the implications of COVID-19 on progression to surgery and adherence to follow-up. A large number of our patients were undergoing procedures since 2017 onward, which could impact adherence to follow-up as well as their progression to surgery.